Good afternoon, everybody, and welcome to Zahn Academy. Today, I have Dan Thornton, CDT, with us, and he's going to be discussing Denture Conversions 101. I want to let everyone know that we would love this to be an interactive webinar, and Dan has come up with quite a few poll questions that he'd like you to answer throughout his presentation. So if you wouldn't mind, when they pop up, if you could answer them for us, we'd really love that. He also will take a live Q&A at the end of his presentation as well. So if you have any questions, please don't hesitate to type them in at the bottom of your screen. Dan, thank you so much for joining us here on Zahn Academy.
It's my pleasure to join you.
So right now, I'm going to pop up that first poll question, if you wouldn't mind answering, and I'm going to turn this over to Dan.
Well, thanks everybody for joining me. And we're going to kind of go over a bunch of different things for the smart denture conversions, anywhere from stackable guides to freehands to anything that you can kind of think of, or maybe you can even find in the surgery when you're there. So, well, let's get started. As you can
And I
see,
just want to let you know that we have some answers to this particular poll. So this is how many are doing conversions right now. 67% of our viewers are not doing conversions and 33% are. So just so you can have that little bit of
nice,
information before we get started.
nice. We get a lot more people out there doing them because it is a big need in the field right now. There's a lot of us that's not doing it, and there's a big demand for it. All right, so let's kind of go over some of the different kind of conversions that you can get into out in the field with some of these offices when you're working with them. You can get any kind from guided surgeries to a freehand surgery and different steps with it, anywhere from stackable guides to denture conversions to smart conversions. And then a lot of times they'll actually look at you of what you need to make the case better at the end. So the best thing to do is actually when you start doing a couple of them, you'll get a little bit more experience underneath your belt, and then you'll kind of actually feel more comfortable talking to the doctors and the surgeons about saying, yes, can you turn that implant one way? Can you move that abutment a different direction? Can we do this instead of that? Can we reduce a little bit more bone here, a little bit more bone there? After a time, you start getting a little bit more familiar with it, a little bit more relaxed with it, a little bit more confident, might as well say. But I'm going to kind of start off with more of the planning for the stackable guides. These are actually kind of cool because then everything you're going to do for this surgery is pre-planned. Anywhere from implant placement to what multi-unit abutments you're going to use to what cylinders you need if you're doing with the titanium cylinders for your dentures. Are you doing a printed denture? Are you doing a custom denture, a traditional denture? And you can actually have a list of all the parts that you need, all the implants that you need, all the components you need. So you can kind of go into the surgery with everything in hand, everything in your surgery box. Now, going over it, upper upper conversions are a lot easier than lower conversions. You have a lot more foundation, more land to work with. You have a little bit more palatal information that you can work with compared to like the lower dentition. Normally, after we start surgery, we lose all reference points besides a little bit mostly in the posterior areas back by the retromolar pads. So you kind of have to kind of go off of what your upper is and kind of use that for your lower to match your upper. Gets a little bit more fun that way. Now, with the planning on the surgery, you'll actually know, like I said, you'll actually know if you're going to do 4 implants, you're going to do 6 implants, but things can change when you're at surgery. Sometimes there could be a 5th implant and you left the 6th one out, or you put 6 in, one's not stable enough to load, so a 7th implant goes in that can actually handle the conversion. Now, myself, when I actually start these cases, I actually like to have photos of the patients so you can kind of see the normal smile, exaggerated smile, and a retracted smile with all of them looking at you eye to eye, straight on photos. It makes it easier for us to kind of plan where the teeth's going to go, especially if you're the one that's going to be designing it or setting the denture up for that conversion. That way you can make sure you get it, giving them a good smile. Now, if you're one that kind of walks into the surgery and you really don't know what's going on till you get there, that gets a little bit more complicated, but it's also a little bit more of the fun of these kind of surgeries because sometimes you can walk in, you have no clue what's going on until you get there, and then you got to kind of plan as you go with that day of surgery. On stackable guides, you have so many different types of stackable guides that you can almost get lost unless you use them or do the research on these stackable guides. There's anywhere from like the magnet system that will actually have the pin to your bone that you can actually pull apart because the next stack will be with a magnet that kind of holds it together. And then it'll give you also your bone reduction. You can have your implant insertion guide for that. It gives you your holes for drilling. You'll have like a step by step what your depth is going to be for your implants. And most of the time, they'll actually have a little marker on there for you can so you can actually see where to stop your implants for timing for your multi-unit abutments. This, like I said, is a little bit easier because everything's kind of planned out. Only time you get in trouble is if the plan doesn't work. The osteotomy was over drilled a little bit, so you have to go to a bigger implants, or the angulation of the implant doesn't allow, so you have to switch from one guide to another guide. Now, when you're using these stackable guides, I always like the ones that have a nice click or a pin or a plunger kind of holding the stacks together. Myself, the magnets are good unless you push too hard with it because it kind of flexes. And sometimes the magnets come apart when you're actually pushing on it. And it could actually get your implants off. That will make our temp go off a little bit. The cylinder be a little to the left, a little to the right. And then you just have to open up your hole in your prosthesis. Now, as you can see, what we like to do is, like I said, you get all the protocols when you're doing the planned surgery. You have almost a step-by-step guide for you. Are you going to be doing a already printed prosthesis? You want to be doing like a smart conversion that actually clicks in? What material are you going to use? All this kind of plays into it when you're actually got everything pre-planned from the stackable guides and also the pre-termination of what we're going to do with that surgery. There's going to be a lot of different products out there for you to use. You almost have to kind of use them and see which one you like, which ones the doctor likes. Are you having any kind of bonding problem? Does it take a special bonding agent? Do you have to sandblast certain things? Is the metal retentive enough to hold your acrylic or your material together with that prosthesis? If anybody's discouraged about blood, sorry, this is our field when we actually go chairside. So as you can see in the photos on the platforms, a couple different ways to actually do these guides with the stackable. You have ones that have a nice platform that kind of tells you at where to put your multi-unit abutments. That's with your stackable guides. And then that platform is used to actually stack the prosthesis with the cylinders. Other ones will actually just re-engage the set pins or the drill pins for the guide so you can actually kind of hold the temp. I've actually seen some that doesn't really use the guide at all. It runs more off the palatal area, almost like a table stand would, which is actually a very cool guide also. Only problem is anything changes in that palatal area, it doesn't really fit. Now, with that said, you can actually have anywhere from an FP1 to an FP3 on these kind of cases. So that's where a lot of the planning comes in with these stackable guides. Now, going over a little bit of things that you'll kind of need when you actually go chairside, especially for any kind of surgery case. Like I said, you're already going to know what the protocol is going to be, what implants it's going to take, what abutments is going to be there. Everything is pre-ordered, ready to go for you at surgery, hopefully. I normally help lay out all the parts for the conversions, making sure that we have all the cylinders, making sure all the implants are in the right location, and then getting ready for actually all the multi-unit abutments, just to make sure hopefully everything goes great. In my toolbox, I normally carry Stellar or some other kind of pickup. Handpiece, obviously. A lot of offices have a place for you and will have a handpiece for you if you're going just in from a conversion standpoint. Some offices will not. I normally carry obviously the burrs that I like to use. A curing light is always in my toolbox. I carry rubber dam because it helps cover up the surgical area if we're picking it up before we actually stitch, or even after we stitch. I still like to use the rubber dam. Kind of gives us a nice barrier so we don't get any of our products underneath the tissue area. Myself, I've always learned to take safety glasses because one time I'm in surgery, I actually had a 4x4 get caught on a burr and I was across the room and I still got hit in the face with blood. So I always walk into the surgery with safety glasses on to protect myself. Now, with the cylinders, I like to plug the holes when we're actually backfilling the holes, just to make sure that we don't get anything down inside of that cylinder hole and get that screw stuck. They actually make some nice little plastic plugs for these. Or one of the other tricks is just getting a cotton swab with a wooden stick with a little bit of Vaseline and breaking it off and putting it in the hole just to protect that area so you don't get anything inside, because it's a bear when you actually sit there and you have to kind of dig that out, or the doctor has to dig that out. And one of the biggest things is if you're the one responsible for the temp or the denture, don't forget it at the lab. That starts out with a bad day. So let's move into freehand surgery. Freehand surgery is one of my favorite surgeries just because you never know what you're going to get. It's going to depend on the good bone that you have to actually, if that implant's going to be stable enough to pick up a prosthesis to hold it with everything together, or it could actually move. Like you could plan on putting an implant number 4 area, but it ends up in number 3 because you found better bone back there, or the doctor found better bone back there. That changes everything. And a lot of times, even when they're doing freehand, they'll ask for a clear guide splint. And that's just kind of giving them a trough, an idea where that implant's going to kind of poke out of the denture or your prosthesis when you get done with it. It's just kind of a reference points for them. Now, like I said, the upper is easier. You have a little bit more palatal area to kind of make sure that's stable, kind of holds it in place. The lower is a little bit more complicated. I normally add a little bit more so I can get all the way around to the flange areas, just so it kind of holds a little bit better on the flange areas compared to we're not going to have any kind of ridge to go by. One of the other little tricks is if you're doing a denture with a clear denture guide, you can actually do a cut in the front of that clear denture where you want that bone to be flattened down to, or hoping to get that bone flattened down to. That way you can actually the doctor can make a cut on the bone to make sure it's in that correct area. And then they just bury the implant to that level and just flatten the bone off. Now with the freehand, we're going to actually have a little bit different circumstances on this. A lot of times the docs will actually place the implants, then flatten the bone down. Compared to the stackable guides, you want to flatten the bone down at first, then place the implants. because that gets most of the gross reduction out of the way. Well, with traditional, like I said, one of my favorites is actually traditional or freehand, just for the fact it is, you don't know what you're going to get. You have to think through the process. Your brain's constantly going of where's that going to come out? How do I pick this up? How do I make this prosthesis look great if I'm off angle in certain areas? The good news is when you actually have your clear denture, you can put the multi-units on. You can put the clear denture back on top of those implants to see if the handles come out of that trough area. And if they don't, you always have time to go, hey, can we move this abutment one more turn, left or right, to kind of get closer to that trough area, just so it kind of helps and actually is better for your teeth. Now, on this, you actually have multiple different ways to do pickups. Like I said, with the stackable, you have stackable guides. They kind of sit on there. You can check the bite before you start picking things up. And it makes it a little bit easier until you start having like the metal cylinders in your way, because a lot of times those are poking up too far. You can't close the bite down. The opposing dentition is actually hitting your cylinders, it's hitting your plugs. So you just kind of check it at first and then just pick it up and trust it. Now, when you're actually picking it up traditional style with the freehand surgery, the way I like to do it is I'm going to step forward, give you a little bit better. I like to actually do it a little bit more with a little bit more of the bite material underneath of it. This is a lot of times when my rubber dam comes involved, just to kind of protect the surgery area, because you can actually do this. And if the surgeon's okay, you can do this while the patient tissue is still flapped open. You're just protecting that area with your rubber dam, and you're just picking up the caps, like the cover caps off those off the multi-unit abutments, so you know where to drill your holes. So with that, you can do two different techniques on this pickup. One is you can actually use that denture, drill the holes, and then you can use like old closed tray transfers to pick it up underneath the denture like a wash. Then you can actually go back to their little lab for the day and pour up a model so you can do your conversion outside the mouth. The little trick I like to do on that one is whatever we pick up in that impression, as you can see, I like to cut the palatal area out a little bit just so it can actually stay there and be part of the stone for the upper, or anything that I'm not planning on using for the final prosthesis. I actually get that away and I pour the stone right to that area and make sure that I keep that impression material there, just so it's going to be a stable pickup. And that's normally when I'm doing it that way. If I'm doing it on a model, I'm normally either using acrylic or I'm actually using more of the dual cure material like Stellar, Zest Pickup, or anything else like that. The other way to do it is you can actually pick it up in the mouth. Now, like I said, this is going to be easier with the upper than it is going to be with the lower, just for the fact that you still have the palatal area to go off of with your denture so it can be picked up in the mouth. You're just going to have to cut the holes a little bit bigger just so you can make sure the cylinder is going through it. I still use rubber dam underneath of that just to protect so we don't get underneath the multi-units even after we are stitched up. And it also gives us a little thin barrier underneath of it for spacing on against that tissue. That leaves for a little space for swelling. Makes it a lot nicer when you go to put the prosthesis back in. And I found out a lot of times with the rubber dam, it's easier to kind of stretch it over and then poke holes where your cylinder's at, just so it's nice and tight on that cylinder. And that way it drapes over top of the ledge of that cylinder too. And it just kind of holds everything down and out of our way while we're trying to do the pickup. Now, when we're doing the pickup within the mouth, with the traditional denture, it's easier to use the light cure slash self cure material because you can cure it faster. It cures within 4 minutes when it's sitting by itself. You can use regular acrylic on it. I would suggest using a faster acrylic than our normal basic that we would use at the lab, just for the fact that it's going to actually be in the patient's mouth. It's going to get pretty warm, so you want to have to protect that surgery area. That's also why I like using a rubber dam. And definitely, if you don't have a nice little pressure pot like you see on the screen, definitely it's easy to get. You can pick one up on Amazon, and it's a very reasonable price. I actually have 2 to 3 of these, leave one at the lab, and I take one in my box every time I go, even if I'm not planning on doing a traditional denture. Now, when you're doing the pickup in the mouth, there's some interesting, fun ways to do it. Like I kind of went over it between making the cylinders fit and everything else. Is the multi-unit in the correct location? Actually, I'm getting a little bit ahead of my slides. It's actually funner when you can actually do this. The stackable guides are easier to do. It's like sometimes you kind of feel like you're just filling the holes unless there's an issue. And then you got to think, how do I get this to work? And over time, you kind of pick that up. If you're doing a traditional way with the freehand, you're used to picking up a denture, like a soft reline or like a nice wash impression. So you're used to setting that bite to the opposing dentition. It's in a way why I like the freehand sometimes a little bit better, just because we can permanently set that bite easier by just kind of manipulating the jaw a little bit when the patient's still sleeping and kind of setting them in that bite that they should be in. But the fun part is there's actually an easier and faster way to do the old school pickup tradition or pickup conversion, and it's called smart conversion. These are actually nice because everything that you need comes in the kit. You're actually you can either use the acrylic, or you can actually use the dual cure material also. It depends on your preference and or what the doctor wants. Some don't like acrylic in the mouth, others don't care. You kind of got used to your clients or communication with them of what you're thinking of doing and what they're okay with. Now, with the smart conversion, your conversion will be faster. You're technically going to do the same thing as you did with your traditional conversion when you're drilling the holes, but you're not going to go all the way through the denture. You're just going to make enough room for your little cylinder that is provided that you're getting in your kit. Now, with that, it has a nice little special screw that makes it very nice. This screw is designed after you do the pickup, you can actually just pop the denture off the multi-units. The screw separates from the head because the head of the screw is like a PEEK material that just slides off the little screw. That makes it easier for your denture conversion because as you're taking it out of the mouth, you don't have to worry about unscrewing the parts, losing a screw, or anything else like that. And the pickup is a lot faster because then you can actually get back to the lab, do all your drilling processes to get those screw holes open. Because when you're picking up with the smart conversion, you're not drilling all the way through the denture before you do the pickup. You're picking up the cylinders first, and then you're drilling through the cylinders to make your little occlusal holes. And then you're going the opposite direction by drilling through the occlusal down your shaft to the cylinder to actually open up the holes at the bare minimum. This will make your conversion stronger because there's a lot more denture material to hold that prosthesis from breaking or twisting or hopefully not falling apart on you while you're doing your conversion. I actually like doing smart conversion better than the old school. It's a lot easier. Now, the only issue is the cylinder is not OEM. So if you have a doctor that wants OEM parts, the cylinders are not OEM, but it's only a temp. It's only going to be in there for hopefully 4 to 6 months. And then when you get to the finals, that's when everything can go back to OEM if that's what the doc wants and everything else. Myself, I stick OEM unless I'm actually asked not to. Then I would change how I order stuff. With this, things that you'll need, as you can see on my screen, most of this stuff comes with your first kit except for the futar. That actually is a nice, good, it sets pretty fast, bite material that you can pick up on in the mouth so you know where you can actually drill your holes and open up for your smart conversion metal cylinders. The little trick of this, and there's videos if you want to find them out on YouTube on smart conversions and everything else, or some other places. I've even found them on Facebook. It does a very good step-by-step guide for you, especially with the conversion. Because also with the rubber dam, we also use a lot of Teflon tape. With the Teflon tape underneath the smart conversion, you don't have to wait for your material to set up all the way. The the tape will actually let you pull that denture out faster than if you had to sit there and wait for the material to set up. And that's just for drilling your holes. That's not for the pickup for the final. Obviously, with the final, you want to actually be using the acrylic or you're going to be using a dual cured resin. Now, what difference from in my toolbox for freehand compared to the stackable guides, it just adds a little bit more stuff to it. If I know I'm just doing a stackable guides, I normally only need kind of the top of my toolbox. So normally it'd be like a pickup material, a stone as a backup. If the doctor wants a model, you can actually pour a stone model from your prosthesis that you picked up in the mouth. Or if you're actually doing like a backup for them, as long as you have a way to use your platform in the lab, you can do a secondary pickup just so they have another prosthesis if they have to. Impression materials, bite materials for freehand. A lot of offices will have it. I don't. Sometimes I go in and like in the surgery, especially with a surgeon, they normally don't carry impression materials. They don't carry bite registration. Uh, so I put it in my toolbox just so I actually have it, just in case I need to pull it out. I normally use the medium body for the pickup. In the fast set, it normally sets up about 3 to 4 minutes. It's a lot better than some of the other ones. It takes a little bit around 7 minutes to set up. Definitely dispense a little bit out of your tip before you actually put it into your temp, just for the fact that sometimes the beginning of it doesn't mix very well. So at least get some of that out of your tip before you can actually go ahead and set it up. Myself, when I do the freehand surgery, I like to make a stone model afterwards. Anyway, I like using snapstone just because of the shrink factor, and it sets up in probably about 3 minutes compared to our traditional stone that would take a little bit longer to set up. Because a lot of times, as you know, if you're using stone, it normally takes 10 to 15 minutes for the regular traditional stone to set up all the way, and then 24 hours after that for it to be completely hard. Snapstone, you have to learn how to work fast with it because it will start setting up in about a minute and a half on you. So you got to be able to work fast and get that prosthesis into the stone with your analog before it sets up, because you don't want to push it, because you're going to push things out of the way and your temp's going to be off. And like I said, I normally carry the pressure pot with me. Makes it very easy. Get them on Amazon. A lot of stuff you can actually need for this, you can get on Amazon or some of the other places, going to be a reasonable price. Rubber dams a little bit more. Obviously, you're going to have to go to some of the purveyors for that. Uh, I normally like using the thicker rubber dam and not the thin stuff, just for the fact it will give us a little better support for the tissue and a little bit more space underneath when we're backfilling through the acrylic or pickup material. Now, you're still going to need for the freehand, you're still going to need your traditional stuff that you was going to use for your stackable handpiece, uh, like your unit, just in case if you're using the like your material to do your denture pickup in the back of the lap or anything else. I normally carry an impression gun, of course, Calvicide, whatever else to make sure that we are safe on our side after it's coming out of the patient's mouth. You can see, like in my toolbox, I have a bunch of other uh, little tricks. Carry a pair of scissors just in case. But definitely, you'll start getting used to what you need to bring with you and what kind of surgery that you're going to be going to. Like I said, a lot of times I don't take my full box. I might have it in my vehicle, but I don't take my full box into the office just for the fact of if I'm doing a stackable, I know it's going to be a little bit less of a product that I need compared to the traditional that I'm going to need everything in the kitchen sink just in case. Polishing burrs, wheels, nice good carbides, nice sharp ones cut through the acrylic, some to get through the metal of the titanium cylinders. It Everything, you just got to plan for almost anything that you can think of for these surgeries that you might need until you start getting used to going to the surgeries or what that office might have that you don't need to take with you, especially if it's a new office you haven't worked with. I normally carry extra stuff, even stuff I don't take in, just to make sure I have it on hand and I can say, hey, I'll be right back. I needed to go to the vehicle, pull in some more equipment. Now, it's always nice. Myself, I like to, after I get done with my conversions, I clean up after myself a little bit. So I kind of leave it the way I found it. So a lot of times they appreciate that a lot. And then and help them if I need to with marking on what abutment was where, what implant was what placement. So technically kind of turn into part of their staff helping them with the record keeping. And especially if I'm the one that's going into the surgery that's providing all the parts and everything else, that way I have a list as a reference for later on. Because then later on, you don't need all that list. You want to be checking all the temps. You're going to be doing everything else again later, making sure everything is torque value before we start picking up for the final prosthesis. Now, I want to say if you want, I can kind of open it up and actually answer any questions you guys have and do this a little bit earlier, kind of give us a little bit more time to kind of go over the Q&A because I think there'll probably be a lot of questions on different materials, on things that we see at every different office we go to.
So sure, right now, we don't have any questions coming into the Q&A. So if anybody has any questions, if they wouldn't mind typing them in. But I do have results for you if you'd like to hear them from the polls.
Yes, please.
Okay, so right now, 100% of our uh, people are not using stackable guides. So I don't know if you want to make any type of comment on that.
Nice. So I was the same way. That's actually how I learned back in the day, was not using stackable guides. I had a lot of surgeons that just did freehand. And that's how I had to kind of learn how to do the old traditional conversions. I started getting more into the stackable a little bit later on in the time frame of learning how the stackables are. Because a lot of times when you start getting in more into the stackables, the technicians not really needed. A staff member can be trained to do the stackable guides. The only issues if there's something that goes wrong in the surgery and something changed, then a lot of times I find out they need guidance on how to reset the bite by hands, or what do we need to do with the prosthesis, either opening the holes up, taking a cylinder or two off so we can pick up like 2 to 3 cylinders at one time, then come back, pick up the other 3. If the angles are divergent or anything, it they'll look forward to you like being a problem solver. to make sure the prosthesis comes out. Now, what I said with the stackable guides, you can actually still have the traditional guide for the surgeon with the implant placement, depth, timing, and everything else. And then you go back to the traditional pickup. You can do that. Stackable guides just make it a little bit easier, and it just makes it to where everything is pre-planned. Myself, I like to think while I'm actually there, so I like it when I actually do freehand, because then I have to technically pay attention a little bit more and go, no, we turn that implant a little bit more? Can we angle that abutment a little bit to the left, a little bit to the right? Uh, can we change this? Can we alter this? Can we reduce a little bit more bone, just in certain areas, just to make the prosthesis a little bit more flatter underneath and an intaglio surface, so it's nice and cleansable. That way we can also control the tissue when it heals. If we actually have that nice flat surface underneath of our prosthesis, that tissue will mimic that prosthesis for your final. And it makes it a lot easier and a lot cleansable for later on, for when we get to either the zirconium or we get to the bar hybrids.
So Dan, the next one was how many of our attendees are using smart conversions? 13% are, and 88% are not.
Okay. I said the same thing when I first saw it come out, because I was a big OEM guy.
Mhm.
It wasn't the metal cylinders that came with that company. It wasn't, the screw that came with that company. Well, with that smart conversion, you still need to use the OEM screw, or a screw that you can get that will work with that cylinder. But over the years, we've actually learned that, okay, it's okay not to be OEM at the beginning. Then normally at the final, I'll go back to OEM. All my prosthesis at the final is normally always OEM, unless the doctor says, no, let's keep with off brands or a secondary screw, because I like this screw because it's a little bit longer. This screw has a certain head on it compared to like Nobel or Straumann, or Implant Director Zimmer. They rather use this screw because it has more of a star head, or like even if it was like the Rosen screw or something else like that.
Now I want to tell you who's printing and who's doing traditional dentures. 38% of our attendees are printing, and 62% are using the traditional method.
Nice, nice. It, digital is coming along so much to where a lot of the conversions that I do is with a printed denture. And the reason is because I can carry a backup. I can print two for the day of surgery, and just anything happens to the first one, I have a backup waiting to go. And then I can leave that with the doctor if by chance that implant fails or the prosthesis needs to come out. They have a backup denture that they don't have to wait for. Now, I only do that with certain clients because some of my clients doesn't want that backup. They don't want to actually have the cost of the backup until if they need it. So that kind of depends on your client too.
Right now, I'm launching a poll that is saying how many of our attendees want to learn about the 100% digital workflow, which is something you're going to be discussing in December, Dan. And it looks like quite a few of our attendees are interested in that. So far, we have a poll that's going, and it seems like 90% and going first want to learn about your 100% digital workflow when it comes to denture conversion. So I just want to let you all know that Dan is coming back to Zahn Academy, and you can register right now for this webinar. It's on December 11th, 2 p.m. Eastern, and Dan will be coming back for the second part, of denture conversion. So we're so happy to see that you're so interested in coming back to hear about becoming completely digital. I do have a couple of questions for you, Dan. And the first is, he's new to conversions? What is the easiest way to get started?
The easiest way to get started with conversions, I would suggest if you're talking with your doctor or your surgeon, and if they want to find out what they want to do.
Mhm.
If they want to do the stackable guide, it'll be a little bit easier on you, just for the fact of everything, like I said, everything's going to be planned. It's going to be a step one, step two, step three process. If they want to do more of a traditional way, they don't want to do a guide, they want to do freehand, definitely get the smart conversion. It's going to make your life a lot easier. Watch the videos. The videos go over a step by step how to do the smart conversions, and it makes it a lot easier for you to get started with it. Now, just in your mind, because if you do the smart conversions, when you get the kit, they give you a model and a denture to kind of try it out to see how it works before you actually go live with a surgery. So you can kind of play with it before you even get to surgery, so you know what to expect and what to look for.
And another of our attendees wants to know, like, what would be the typical charge for a denture conversion? And Dan, if that's something you would like me to get an email for you to answer that particular question, we can do that. Or you can let us know basically what you think the right thing to be for our attendees would be.
The hardest thing is this is one of the ups and downs on all of this. It depends on the lab that you're working with. It depends on the time frame that you're out of the office. And it ranges different from the like it ranges from if you're doing them, or it ranges if you're hiring somebody to do them for you. So it all comes down to, like, I could have some doctors just like right around the door from me. I'm not going to charge them a like as if I'm going 200 miles away. It's going. I have different pricing for different time frame and different lengths of travel I have to do. So if I'm doing one, like I'm here in Canton, Ohio, if I'm doing one in Columbus, Ohio, it's going to be more than if I actually did one here in Canton, Ohio. But I'm also going, either I'm doing it for a single or I'm doing it for a double. Now that's going to, like I said, it's going to have to almost be in your mind. You're going to have to think, am I providing the materials for this? Am I providing the parts for this? Am I providing, what am I providing for this surgery besides just my time? And how much is your time worth to you for when you actually give that quote out? I'm sorry, I didn't give the exact number, but
Yeah,
you got to play with it depending on what's going on.
there's a lot of factors and they have to do kind of like their homework, right, to figure that
Correct.
out. And please, if you have any questions, type them in at the bottom. I just want to go over like what's upcoming in Zahn Academy. So on November 20th, we have a lecture with Dennis Urban, who is the CDT of the year for NBC, and he's going to be speaking on the different types of zirconia, restorative solutions from monolithic to layered. So that is on 11/20. On December 3rd, we have Carl Horrocks coming in from 3Shape, and he's going to be talking about their new updates and software. So that's one that we're just adding to Zahn Academy now. So that may take a couple of days, but please, if you're a 3Shape user, you don't want to miss that one. On December 4th, we have an easy path to FDA validated milled abutments, and that's with Jimmy Stegall, CDT. And like I said, Danny Thornton is back on December 11th, and he's going to be doing the digital workflow for denture conversions from a patient case from start to finish. So that's going to be something you definitely don't want to miss. Hopefully, you guys just get right back on and register for that one as soon as you can. So we have another question, Dan, and it says, how long does a denture conversion typically take?
If you're talking about a traditional denture conversion, and if you're asking if it's from after it comes out of the patient's mouth to when you're actually getting it done, if you're using acrylic, it takes a little bit longer just because it has to set up in hot water, pressure pot, cut it back, and everything else. If you're using a dual cure material, it goes faster as long as it's bonding to your denture. So you have to make sure if it's a printed denture, will that material bond to that printed denture? If it's a traditional denture, you normally won't have a problem with the bond if you're using a certain product. Like I myself, I found the Stellar works very well on a printed denture or a traditional denture. It bonds very well to it. So it's like, tell you the truth, if I'm doing the old school way, I normally would be back in the operatory around probably about an hour, if not less. Now, with a smart conversion, that's different. You can actually get that down to be about 15 minutes, if not about 25. So you can do smart conversion faster. And you definitely want to use more of like the like your material if you want to speed that process up.
Hey, we can keep the questions coming, Dan. Thank you so much for being so gracious of your time and your expertise for sure. We look forward to having you back in December. So pick up where we left off here for being totally digital. But I want to let everybody know we're Zahn Dental's hitting the road again. And I'm sorry. We're heading to Houston, Texas, and that's where we're going to be giving a spectacular road show, the last of 2024. But stay tuned for 2025. We're hitting the road again all next year to bring you the best in education in 3D printing, materials, milling, zirconia, all new innovation at your doorstep. So, like I said, this Friday, November 15th, we are going to be in beautiful Houston, Texas, but stay tuned for 2025. We are going to be putting out those dates and all the cities that we'll be returning to. So, we're so excited for what's upcoming in this next year in education. Dan, I want to thank you so much for everything that you gave our customers today, and can't wait to see you back in December. And I wish everybody a wonderful rest of your day. And thank you so much for trusting your education with us here at Zahn Academy.
Yeah, definitely stay tuned for December because I'm actually one of the big digital guys in this area. Anywhere from photogrammetry to grammetry to stackable to showing you how to stack the case, especially with scan markers, doing everything digital to printing to giving back the prosthesis within an hour and a half to 2 hours.
Excellent. And I want to thank all of our attendees for being so interactive with us. This was great today. We really, really appreciate your input. Thank you. Thank you, Dan, again. Have a wonderful day.